More than 50 people have died in northwestern Democratic Republic of Congo because of a mystery virus. According to health experts from Bikoro Hospital, a regional monitoring center, the symptoms resemble those linked to deadly viruses such as Ebola and dengue. The outbreak started at the end of January. The virus was first discovered in 3 children who ate a bat. More than 400 cases have been recorded so far. Let's hear more on this now. I'm very pleased to welcome Margaret Harris, a spokesperson for the World Health Organization. Let's start with some of the basics. What do we know so far about this disease?
So what we do know is that indeed there have been a lot of cases. On the 13th of February, health authorities in the Democratic Republic of Congo reported clusters in 2 different villages. Now, even though they're both in Equateur province, which is in the northwest of Congo, the remoteness and the poor infrastructure mean they're actually very separated, and it could be completely different things. Now, you mentioned the report of the children who ate a bat, and there was a cluster of cases, most of whom died in that village. That was Bikoro village. They were tested for Ebola in Marburg, and they came back negative. And now we have another cluster of cases in another village called Bomate village. And as I said, it could be completely different things because they may not be epidemiologically linked because the geography is so difficult. Now, the samples had been taken, and none of them came back positive for either Ebola or Marburg, but we're not really satisfied with the sampling. So we've sent 2 WHO epidemiologists up there. They're up there now, and they're overseeing the sampling and getting them back to the laboratories in Kinshasa. So ideally, we'll have a much clearer idea by the end of this week.
At this stage, is it already possible to say whether it seems likely that this is a new virus or possibly something that is already known?
It's most likely to be something that's already known, or it may be even a whole bunch of different things. We do know, for instance, when the medical teams have done rapid diagnostic testing for malaria, 50% have come back positive. So it could be, say, winter viruses on top of malaria, which can kill people very quickly, especially if they're not getting enough to eat and they're not in great condition. We found that in a cluster of cases that was initially represented as a cluster of mysterious disease down in Angola, and it turned out to be a mixed picture. So really, at the moment, we've got a range of what you call differential diagnoses, but the most important thing is to do the full epidemiological investigation and do the testing.
Okay, so we will have to wait on those results, of course. One thing many will be wondering about, though, is the spread of whatever this is, whether it's 2 different things, many different things. More than 400 cases since the end of January and more than 50 deaths. Is that something that is alarming?
Certainly the case fatality rate is high. We've actually measured it as 12%. We've got more deaths than those that you've just mentioned. So, in fact, 45 deaths were recorded in Bomate village out of 419 cases. So that's a case fatality rate of over 10%. That's very, very high for any kind of outbreak. So yes, we're very concerned, and we want to understand what's going on there. And again, and not only are we investigating, but we're also going up there to have sent a lot of supplies and assistance up there to strengthen the health system, to strengthen the health care, and to strengthen the infection prevention and control activities. That's to stop spread. Even if you don't know what it is, you can stop the spread of something by taking the right measures.
And exactly what measures are those? That's the obvious next question. What do you do to stop whatever this is from spreading further?
So, for instance, when you've got people in hospital, you make sure that you separate them so that you make sure that the medical and nursing staff use proper protective equipment to prevent becoming infected themselves. Go to the families of the people who are infected, we don't know, affected, I should say, and advise them on how to recognize any symptoms and how to take the standard hygiene measures to ensure that if it is an infectious agent. It's not transmitted easily in the families. And you set up a separation of the people coming in and the rest of the population in the different hospitals and health centres to make sure that people who are coming in for care are not infecting people who are coming in for other things.
Well, thank you so much for joining us today on DW News with those insights. We've been speaking to Margaret Harris, a spokesperson with the World Health Organization.
It's a pleasure.